Dr. Courtney Wolf Christensen, and I'm a pediatric psychologist at Cook Children's Medical Center in Fort Worth, Texas. I work full-time in urology, and I'm the co-director of our Spina Bifida program, which we call the STRONG program. Today, we're going to talk about caring for your child during COVID-19. There will be several sections that we're going to talk about. We'll start talking about parents' adjustment, children's adjustment, talking to your child, and I'll give you some coping strategies that you can use. And then some specific concerns that parents of kids with spina bifida have brought up during this COVID-19 time, and then a list of resources with links and everything where you can get more information. So we are going to talk about parents' adjustment. So we're living at a time where everything is uncertain, right? We've never gone through anything like this before. We know that uncertainty is strongly related to higher levels of depression, anxiety, post-traumatic stress. And so we're trying to balance all of this, right? So some of us are working from home and caring for children. Some of us are working on the front lines and then worry about coming home to your families and potentially bringing the virus home. Some people are homeschooling multiple grade levels at the same time. And all of this and this uncertainty can also trigger histories of trauma. So those parents that have those histories are at even more increased risk to be struggling with this. And I will tell you that I am in it with you, and I will consider this to be successful if we can get through it without either a child, spouse, or dog opening the door to the office. So here we go. So what does life look like, right? On social media, it looks perfect. Oh yes, everyone's doing their work and everyone's smiling, but then we know what real life is like. It's this, right? It's chaos. And we've been home, 4, 5, 6 weeks, depending on when y'all started quarantining, and it's just a lot. People have gotten kind of to the end of their ropes and probably let a lot of things go now that they wouldn't have a few weeks ago, and we're going to talk about what that's okay. So what we know about kids who do well, whether it's a medical diagnosis or difficulty in school or just adjusting to divorce, all of those things. So there's a lot of research that tells us that the kids who are best adjusted at the end of something come from parents who are well adjusted. So one of the things that we really need to talk about before we can talk about child's adjustment, is what can you do as a parent so that your parenting is more effective, right? So one thing I like to say is that anxiety is contagious. So if you are not an anxious person and you're in the room with somebody with a lot of anxiety, you will feel yourself starting to become anxious. Your heart might race a little bit, you might have sweaty palms, you might just feel uncomfortable. And so we have to think about that in our homes with our kids, right? So if we're anxious about something, they're gonna see it. They might not even interpret it correctly, right? And then they're gonna be more anxious. So we also need to show our kids the importance of modeling good coping strategies. And sometimes that coping strategy is, oh my goodness, mom needs a timeout. I am gonna go out on the patio and do some breathing for a few minutes and then I'll be back in, right? Acknowledging that you are struggling with some of this too and that you have to work to get rid of the anxiety. It's not just a kid thing. This one's really hard. Staying calm even if you don't feel it. This is like holding it together in front of your child and then realizing as soon as you leave the room, you can cry or break down or do whatever you need to do. But in front of that child, have to look like you've got it together. Also, acknowledge your limits. We're going to talk in a minute about that. We cannot do everything at 100%. Okay, you can't be a mother 100% of the time or a father 100% of the time. And I will apologize that I keep going back to moms, but this is for dads, grandparents, caregivers, nannies, whoever is in the house with the kids. And be able to give 100% of your effort to homeschooling and 100% of your effort to work. It just doesn't work. We all have our limits, and once we acknowledge that, that reduces stress too. And then finally, asking for help, whether this is help from friends or family, or if you're really struggling, I have phone numbers at the end that we can talk about that have crisis lines and other ways to get help. So what are some things that you can do as a parent? So the first one is wake up and get dressed every day. And I'm sure we've all seen all the jokes about night pajamas versus day pajamas. And this doesn't mean that you have to be uncomfortable. You can certainly put on comfortable clothes, but it's the act of actually waking up and getting dressed. And so this is actually one of the behaviors that when people are depressed, this is kind of the number one thing we tell them to do, right? Is get up and get started. The second thing, don't say anything to yourself that you wouldn't say to a friend. So don't get down on yourself for feeling as anxious as you are, because would you look at your neighbor and say, why in the world are you acting like this? You are being so ridiculous. So don't say that to yourself. Don't treat yourself worse than you would treat other people. Make time for yourself. I know this is one of those that we always hear, and I know it's not easy, especially now that we have all this increase and pressure and responsibility, but we have to figure out how can we make time for ourselves. And this doesn't have to be a lot of time, it just has to be time that you're able to use efficiently. So if you're doing some mindfulness training or some yoga or just some breathing or reading either reading a book or reading some strategies that could help you cope, whatever that is, have to try to figure out how to fit that in. The next one, and that's the picture that you're seeing, is set up virtual babysitters. Obviously, this doesn't work for all age groups, but if you have kids who are old enough to be able to sit in front of a tablet or a phone and maybe talk to grandparents, maybe talk to friends and aunts and uncles, and I've heard of people having grandparents read bedtime stories to the kids. And this is actually something that would be super helpful for you if you have an important meeting. So for example, I'm here right now talking to y'all. This would be a great time to make sure my kids are being watched by somebody else, right? But that they're busy and I know that they're safe and I can do what I need to do. So again, talk to grandparents, talk to friends, and figure out, could they help you during specific times of the day? Because that will actually relieve quite a bit of pressure. Prioritize your schedule. So some days work is going to take precedent. Some days parenting is going to take precedent. Sometimes it's school, whatever it is. It can change on a day-to-day basis. And again, if you have that important meeting at 11 o'clock in the morning, that is the first priority for your day, right? And so you want to make sure that you have that covered and a plan for your child before moving on. This one's a hard one. So stress less about screen time. I know all we hear is limit screen time, limit screen time. Look, you might have to get to a point where you just say, you know what, until we go back to living a more typical lifestyle, I just give up on screen time. And it's okay. It's okay to let that go. Be creative about office space. So, if you're able to take a computer outside, maybe you could have your kids outside too, maybe running around, but just changing where you are. Again, being creative. And I want you to know, I was looking for pictures and there were all these beautiful pictures of people sitting on beaches. And I know that's not quite realistic for many of us, or most of us, I should say. But just kind of try to think outside the box a little bit. Connect with friends and family. This is hard, whether it's via FaceTime or Zoom or WebEx or however you're communicating. It's important that you don't lose contact with these people, but it's actually even more beneficial if when you talk to them, you're seeing them. So texting is great, talking on the phone is great, but kind of the best way to stay connected is via some sort of video. And the last thing, and this is in big letters, be realistic. Be realistic. Don't be so hard on yourself. Realize that every day something is going to go wrong, right? But every day things are going to go right. So we are going to talk about children's adjustment during this crazy COVID-19 time. So what we know about children, and this does happen to adults a little bit too, but most often for children, their emotional stress comes out as physical behaviors, right? So you might see an increase in temper tantrums, you might see an increase in meltdowns. Sometimes you kind of see the opposite, and your child might have some separation anxiety, might always want to be with you, not wanting to sleep in their own bed, those kinds of things. Some kids get really quiet and shut down and maybe hole themselves up in a different room with the door closed. And the other thing to really look out for is irritability. Because unlike depression in adults, when we think about depression in adults, we think about being sad and down. And while that can be true for children as well, actually the number one symptom of depression in children and teenagers is irritability. So kind of keep that in mind. The other thing that can happen that I actually didn't put on my list is that sometimes kids can have somatic complaints like headaches and stomach aches. Those are the two kind of most common ones. So if your kiddos are complaining of, just abdominal pain or whatever it is, not that you shouldn't take that seriously, but kind of take a step back and think about, could there be something else that's contributing to this? We know children have difficulty identifying their feelings, right? So especially frustration and anger, they don't know how to label those, so they're going to need your help. Children often worry. Like I had mentioned, children's sadness can manifest as irritability, so keep an eye on that. And most children benefit from having a routine. So when we talk about worrying during COVID-19, so these are worries that are different from what kids potentially worried about 6 months ago, right? Some of them could be the same, but some of them are now faced with new situations, parents losing jobs, food insecurity, worrying about loved ones getting sick and dying. If parents are losing jobs, does that mean that you can still stay where you're living, or do you have to move somewhere else? Does that change? And I did put, and I don't know the answer to this, I have not seen any data, but whether children of those who are working on the front lines, if they have higher levels of anxiety, especially about people getting sick, and it wouldn't shock me for that to be true, but I do want to make sure that I emphasize there are no data behind this statement. This is just kind of my feeling. The other thing during COVID-19, sadness, depression. So our kids are not seeing their friends. This is especially important, and as you get older, middle school, high school, struggling with electronic learning, this distance learning stuff, there are a lot of factors that go into it. So making sure that you have the right equipment, making sure that all the links are working, making sure that you understand it. And this is especially hard for kids who have learning difficulties, right? So when our kids with learning difficulties are in school, they have specialists, right, who work with them on how to best work through their difficulties, maybe some tricks to make things a little bit easier. And unfortunately, as parents, most of us don't know those skills. So if your kiddo already struggles in school, this can be even more difficult for them. Some of our kids miss their teachers, and this is kind of more of like the elementary, kindergarten type stuff. Some of our kids miss being able to spend time with grandparents. If you are physically isolating, and maybe you see grandparents through a door or from the car, but not actually being able to be with them. And then not participating in after-school activities. So our kids who are involved in dance and sports, and piano lessons, and my kids do karate, and all of those things. Sometimes you can do it online. A lot of these places are doing Zoom lessons, but it's not the same as being in a room with everybody. So we are going to talk about a step-by-step way to talk to your child, and then talk about some other coping skills. So talking to your child about their feelings. This is not something that is exclusive to during the COVID-19 pandemic. These are steps that you can kind of put in the back of your head as ways that you can talk to your child about their feelings about anything. And you'll see the examples are related to COVID-19, but again, the 4 steps can be generalized to anything. So the first question is ask your child what they know about COVID-19. Use this opportunity to better understand your child's worry. Sometimes kids have these thoughts that, for example, if one person in our city is diagnosed with COVID-19, it means everybody is going to be diagnosed with COVID-19, and almost all of those people are going to die, right? So we know that that's not accurate, and that sounds really scary. And if that's what they're worrying about, we need to bring them back, give them correct information. So whether their worries are rational or not, those are still things that they're worrying about, right? And you can't tell other people how to feel. You can't tell them, oh, just don't worry about that, it's fine. But it's not, because they're worrying about it, right? So we have to really address these things. So when they tell you what they know about COVID-19, rational or not, kind of keep track of that in your head so that when you go to these next steps, you can address it. And sometimes some of those really big incorrect things, for example, one person getting sick in your community and wiping the entire community out, you can talk about that right in the moment, you know, and it's possible that your child was walking by and heard you on the phone with somebody talking about this, or walking by and heard a news story and didn't quite understand what they were talking about, right? So that's the first step, is to figure out where is your child. Second thing is to validate their feelings, right? So child tells you, I'm just really scared that, you know, grandma's gonna die from COVID-19, grandma's old, they say this is affecting old people, and I'm really scared, and she is still leaving the house and going grocery shopping, and she won't wear a mask, whatever that is, right? So validate their feelings. So it sounds like you're worried that grandma could die from COVID-19. Kind of summarize what they're feeling, give them a feeling, in this case, worry sometimes, and we'll talk about it's being scared or being happy or being lonely, whatever that is, name that feeling for them. And then we're gonna move on in a second. But so another one might be, you're scared that we might run out of food this week, like we did last week, right? So a lot of families are facing food insecurity right now who have never experienced this in the past. And especially if you do really have a rough week and you do run out of food, that obviously is going to contribute to more worry from your kids about, well, it happened once, so maybe it could happen again. Step 3 is normalize their feelings, right? So it would be really scary to think that grandma could die for COVID-19. Like, that makes sense, right? It makes sense that you would worry about running out of food because it's happened to us before. Some other things, maybe not necessarily related to COVID-19, but if you're talking more generally to your kids, this is a really good place to allow them to be angry. So for example, they're really upset because their best friend canceled plans with them, and they're really upset about that, right? So you could go in and normalize their feelings and say, I would be really angry and really hurt if my best friend did that to me, because now you're opening the door for them to express negative feelings, right? And they're like, yeah, I am. I'm really mad, or I'm really hurt. So that's just kind of one of those ways to open up the communication with your kids. And it's okay for them to have negative feelings. It's okay for all of us to have negative feelings. It's what we do with those feelings that's important. And finally, problem solve. And remember, you can always come back with ideas about ways that you can address your children's concerns. You don't have to think on the fly. So brainstorm especially things that you can control, right? So what are the things that we can control right now? Doesn't feel like there's a lot of them, but there are definitely some. So hand washing, right? Talking to your kids about the importance of that 20-second scrub, either singing or counting, whatever that is. Physically distancing. So, leaving 6 feet in between you and somebody else. If y'all are outside, maybe, and neighbors come over, making sure that you're still maintaining that distance. And I had somebody tell me this, and it really makes sense. Instead of thinking about socially distancing, where you might think about actually emotionally distancing yourself, think of this more as physically distancing. We don't want you to emotionally distance. Connecting with others via FaceTime. So, you're worried about grandma. Well, hey, maybe we should call grandma and see how she's feeling. Or, plan that we're going to call grandma every night before we go to bed. The hard thing right now, though, is that we can't promise our children that grandma's not going to get sick, right? Unfortunately, it's the reality. And you can't promise your children anything that you cannot carry through with 100% certainty, because the next time you promise, they're not going to buy it, right? And so being honest about that. I can't promise you that this isn't going to happen, but what are things that we can do? We can call grandma and make sure she's washing her hands or wearing a mask, whatever it is. And then talk about strategies to directly address the worry. So for example, for that kiddo that's really worried about running out of food, maybe you say, hey, I understand why you're worried. I was scared and worried too. And so what I did is I talked to somebody at the community center, and they told me about this other food pantry that we didn't know about. So on Monday, we can actually go to 2 different places and get food. And so we will definitely have enough food to get it through the week, right? We don't want to put our worries on our kids, but we do want them to realize, again, it's normal, right? So establishing a routine, and this is something that has come up a lot with parents. And I wish there was some magic kind of potion that I could give makes this all work. So a few things to think about. A strict hour-to-hour inflexible routine is bound to fail. It's just not realistic. It's not realistic for adults, and it's definitely not realistic for kids, right? Then you have to think about your individual child and what would work best for him or her. So some kids have a routine, and just making some adjustments here and there works for them. And then some kids, this whole COVID-19 situation is so different for them that they can't even maintain their typical routine. And so if that's what's happening, I would recommend you leave typical routine back. Hopefully we will get there, right? Get back to our typical lives, and then create a new routine during COVID-19. And I know at this point, this is going to really vary based on the age of your child or your children. And so I apologize if some of this isn't exactly relevant to everybody, but I just kind of tried to pick some things that would hopefully reach the most number of people. So sit down as a family and discuss what activities should be on the schedule. And these are just some ideas, right? So get dressed, brush hair, brush teeth, catheterize. I don't know about you, but in my house, we have to remind to brush teeth every day. Not sure why, but I actually have to say it, right? So doing physical activity, lunch, quiet time, chores, whatever that looks like in your house, you want to come up with these headings, right? These overall activities, categories. And then we're going to talk on the next slide too, but within those categories, you want your child or your children to come up with ideas that they could do during those times. It could be different for every child, and likely it would be, right? And you can allow children and teenagers to have some sort of control over what the actual schedule looks like. We know teenagers work best later in the day. So if they say, I don't want to do school from 9 to 11, I want to do school from 5 p.m. to 7 p.m. Well, we have to work with them, right? And we all are much more likely to follow through things that we have control over or that we have had input in, right? So giving your children those kinds of choices will hopefully encourage them to do what y'all have planned. So this is the idea. I kind of took those categories: physical activities, ride bikes, go for a run, wheelchair sprints. My house, we practice karate, whatever that looks like. Free time, play with Legos, video games, maybe outside with chalk. Screen time, and this is, as a parent, you kind of get to decide, do things that go in screen time also get to go in free time? Excuse me, or not. You decide that, right? So your kids can decide what they want to do, and then you as the parent have the final say over where it goes on the list, right? Reading time, chores, quiet time, and lunch. So on the left, have an example of a routine chart that might be relevant for elementary and middle school age kiddos. It does have times on the side of it. You are certainly not expected to be watching your watch and say, oh, it's 10:02, we're supposed to be doing physical activity. This is just to give you and your head an idea of kind of what comes before lunch. In my mind, everything's around food, right? So we have breakfast, and then we might have a snack, and we have lunch, and another snack, and dinner. And I actually didn't even put snacks in here, which is crazy to me because it's not my thing. But anyways, you can see that in the schoolwork area, they have to do math, science, English, social studies, art, and computers. And giving them this information makes it less likely that they're going to need your help to figure out what they have to do. And if you print something like this out, kids can cross off what are the subjects that they finished. So it's very easy for them to look and say, oh, the only thing I have left to do is science, right? Physical activity, so for those couple of hours, they can do whatever they want that fits into that. And these are just some examples. And so this is to give them ideas so they're not constantly coming to you and asking, oh, what am I supposed to do now? I'm so bored. Because they came up with these ideas. We talk about doing chores, and you can decide in your house whether that means do one or two of these things, or it means you need to do all of them every day. Again, really easy way to check them off. Free play, another schoolwork kind of block. This depends on how much work your kiddos have to do. Some would prefer just to get it all done in the morning. Others would prefer to do it in the afternoon. Sometimes you have to separate that for them. And then kind of we have screen time until 5 o'clock. And then in my mind at 5 o'clock, there are no rules. Anything goes after 5. So again, the chances that you and your family stick to this routine, like to a T every day, it's not going to happen. But at least this gives you some sort of structure. And then on the right side of the screen, we have what we call visual schedule example. And this is often if you have kids in lower elementary school, so pre-K, nursery school, pre-K, kindergarten, first grade, they might have what's called a visual schedule up at the front of the room. And so they know that when they come in, they sit in a circle, and then they do their calendar time, and then they do their songs, whatever that is. And your kids are used to being able to look at the board and know what's coming next, right? And so that's kind of what this visual schedule does. So yes, I know that the catheter is a Foley catheter, not a straight catheter, but it's virtually impossible to find a picture of a straight catheter that is not linked to a manufacturer. So pretend that's a straight catheter. So, a reminder, you need to catheterize. The next thing, you need to make your bed. You need to get dressed. You need to brush your teeth, right? So all of those things, if they have this up in their bathroom or in their bedroom, they don't need to come and ask you. They can do it. And little kids really love checking things off. And then you can see as we get to kind of the physical activity piece of our 10 to 12 on our older kids, we have those pictures of things that they could do instead. So again, giving them choices, giving them some of the responsibility of figuring out what to do. Totally switching gears on you. The next thing is what we call coping skills bingo. And I apologize if you've heard me talk about this in the past, but it's one of my favorites. So the first thing you want to do is identify a list of coping skills for children. There will be some links at the end. There are also already some links on the SBA website in the COVID-19 category, or I'm sorry, yeah, area of the website. And so you can go there and click on any of the links, right? So then you're going to talk to your kids about this list, go through it with them, and have them think about which coping skills they might like to use. So for example, take dog for a walk, take a long bath, do breathing, journaling, positive self-statements, whatever that looks like for that kid. And I'm going to show you a couple of examples. And so this is one that my son did for me this morning. And so this bingo card is also available on SBA's website. But you can see that he says, hug a pet. He's a really big dog person. Walk the dog, call a friend, snuggle. So these are the coping strategies that worked for him. And then these are the coping strategies, if you can see, that my daughter came up with. And so hers involves play a sport, ask someone you love for a hug, take a nap. And so these can both be hanging somewhere, whether it's on the fridge, whether it's in bedrooms. And this is a good reminder if kids are feeling overwhelmed, you tell them to go check their coping skills board, right? And then you can also challenge them to bingo. So for example, who can get a line, a diagonal line, horizontal line, vertical line, four corners, whatever it is. And you can kind of play around with it and make it more of a game. And then the nice thing about this is it's only 9 options. So when the kids get tired of the options on here, you can throw this away, print off another one, and give them that list of 50 or 100 coping skills and let them make a new one. If there are some coping skills they really like, you can they can put that on the next one too. But we want them to have kind of a finite number of things to look at, because handing a list of 100 things to a 9-year-old who's already feeling overwhelmed and stressed is probably not going to be beneficial for anybody. And then reward them for getting a bingo. Rewards look different in different homes. So y'all have to figure out what works for you. Is it a special treat to eat? Again, I go back to food. Or is it, one-on-one time with mom or dad before bed, or an extra story before bed? Staying up 15 minutes late, that's a big one. Maybe a little bit less now with COVID and all of the craziness, the lack of schedules, but keep that in mind for once our kids go back to school. For some reason, little ones love the staying up late option. And so the next couple of slides, I'm going to show you some other places that you can go to get coping tools. One of my most favorite sites is called teacherspayteachers.com. The reason is because all of these activities are written and developed by teachers, school counselors, people who know our kids, right? And so some of them are free, and then some of them do have kind of costs associated with it. And so just to make sure this is clear, these are literally just examples that I grabbed. I am certainly not necessarily recommending one or both or two or all of these. I have not had the chance to actually go through them, but I just wanted to let you see what it looks like. You can search in the top corner for what you're looking for, and then if you look down kind of the left column, you can filter your search. And so if you just want to look for free options, click the free button, and then everything that comes up will be free. I do want to draw your attention to the bottom right corner though, this Palm Llama thing. You'll see there is what looks like a thermometer. And I think thermometers are really helpful for kids, right? Because it gives them a visual of what are they feeling. So where are they from extremely calm to losing their mind and melting down or tantruming, whatever that is, where do they fall in between? And really helping them realize, okay, you're a little bit worried, but you're going to be okay. Or then as a parent, oh, hey, I'm going to need to intervene because we're starting to climb up that thermometer. So thermometers are great for kids, and especially if they have descriptions next to them. I really love that because then you can look, and we use this for pain. see, I always get off on tangents. We use it for pain, but instead of just asking a kid on a scale from 0 to 10, how much are you hurting? And they say 9, but they're sitting in their bed and they're eating and they're texting with friends and pretending to talk to you, but really ignoring you. That's not really a 9 out of 10 pain, right? And so if I gave them a sheet and that said maybe at 4, you're still able to eat, chat with friends, talk to people, get out of bed, and at 9, you are in tears, unable to pay attention, don't want to move, those kinds of things, it's really easy to show that to them and say, okay, let's back up. Where are you on the schedule? So the functional scale is what that would be called, and that's super helpful. Another great place to look for options is Pinterest. As you can see, I just typed in coping skills for kids, and this is just the top of all of the options that came up. You can look for free worksheets. A lot of these will actually go back to Teachers Pay Teachers, which is how I found it in the first place. But just a really good place to start. It can be overwhelming though. So I would say kind of limit how much time you're spending trying to figure all this stuff out, and just give yourself a break. So now we're going to talk about specific concerns for parents of kids with spina bifida. And for this section, I asked a couple moms of my patients to reach out to other moms and ask what things are most concerning to you right now during COVID-19 so we can talk about them. So the first thing that came up is infection concerns, right? Our kids are already at risk, higher risk for having complications if they get sick. And so what are some things we can do? Really wash your hands, super easy, but it's the best way to keep yourself healthy. Using soap and water, 20 seconds, the whole thing that I know you've heard 1,000 times, just don't forget it. You can use hand sanitizer that it has at least 70% alcohol. If your kiddo is in a manual wheelchair, make sure that you are frequently wiping down wheels, push rims, brake handles, push handles, any part of the chair that hands are touching, essentially. And then one other thing that actually came out during another webinar is the importance of hand washing and good hygiene before and after bladder or bowel management. So before capping or ACE flushes or cone enemas, whatever it is that your child uses, this is extremely important to make sure that you are washing hands and doing all of that. There is some suggestion that COVID-19 could potentially be spread in urine and feces. And so again, another reason to really look at the hygiene. Another concern is having difficulty obtaining your regular DME supplies, right? They come on a monthly basis, and you're worried that maybe the company that you're working with isn't able to get your catheters or your diapers or whatever it is. So kind of a few things to think about. Plan ahead, kind of a little hard now because we're in it, right? But I know that there are a lot of families who end up with a closet full of catheters because they were getting more than they were using every month and they were just kind of hanging on to them. So again, if that is happening to you, hopefully you've planned ahead or talked to friends who have planned ahead and could help. Another option is to call the office of the prescribing physician. So like in our clinic in urology, our physicians sign all the DME orders. You could call me and I could go to our closet and say, oh, I do have, a 12 French. It's not the same brand that you typically use, but I have these and you're welcome to either come and get them from the clinic or I can mail them to you, whatever that is. Check with your local Spina Bifida Association chapter. And again, I'm sorry, I don't know what everyone else is doing. As part of the Spina Bifida Association of North Texas, I can tell you that there is a closet, and by closet, it's a huge room actually, that is full of any DME supply you could think of, any size catheter, any shape. It's incredible how much stuff is in there. So check with your chapter and see if they have something like that. And that's a place that a lot of our families go if they don't have insurance coverage. or they're having to pay out of pocket for these kinds of things. So kind of separate from COVID, if you fall into that category, you could potentially ask too. Check with local Spina Bifida parent groups. Again, if you're in those kind of parent groups on Facebook or Yahoo, wherever it is, even sending out a message and saying, hey, I'm running really low on 10 French straight catheters. And there might be another parent who says, well, great, because I have an entire box of them because we moved from 10 to 12 and we still got the 10. So work with each other. The last option, and again, this is kind of a last resort. I'm not suggesting that everybody start changing companies. But if you cannot get your supplies and you've tried all of these other things, one option is to consider changing DME companies. So several of the larger companies have assurances in place that they won't have difficulty continuing to fill orders. So just keep that in the back of your head. And again, final option, because in order for this to happen too, you also are going to need a new prescription from your physician. New forms have to be filled out for insurance. So it's not nearly as easy as just picking up the phone and saying, hey, I want to switch to whatever company it is. But keep it in mind. Concerns about missed doctor's appointments. And this is a really hard one because if your kiddos clinics are anything like our clinics, we are scheduling months out, right? And so trying to figure out how those missed appointments are going to fit into a schedule that is already full of appointments. Look, we're in it with you, and I wish I had an answer for you. So a few things that I would recommend. If you have a patient portal, you can utilize that to send messages directly to your physicians or to their nurses or whatever it is, right? You can contact the doctor's office directly and ask them, hey, what are your plans for rescheduling? What is the policy? I just want to have a plan in place because just having a plan will reduce some of that anxiety for you or that uncertainty. Thinking about things like yearly follow-up appointments. Oh, every summer we do urodynamics and renal ultrasound, renal function panel, and see our urologist. It's just what we do, right? And then we see the neurosurgeon and all of that. I wouldn't stress too much about that. If your kiddo is doing really well and is on, their yearly follow-ups, then you probably are one of those people that could maybe wait. So instead of coming in July, maybe you come in September this year, right? I'm certainly not saying don't do your yearly follow-ups, but just think about being a little bit more flexible, and then think about those other patients who have more urgent issues and that they need to kind of get into those earlier spots. Urgent issues absolutely still need to be addressed. You need to contact your child's doctor if you're concerned. Keep track of your questions and concerns, whether it's on your phone, on a piece of paper, so that when you do see your child's physician, you can ask those questions. And then consider telemedicine appointments if physical exams are not needed. And I know in our clinic right now, we're doing a lot of telemed appointments. And so that's a way that, face-to-face with your physician or nurse practitioner, physician assistant, whoever that person is, but just to at least be able to see them and get some feedback. And then concerns about missed therapy appointments. And this is a really hard one, and honestly, the one that I had kind of the most difficulty coming up with some answers for you too. So the first thing would be consider practicing the homework that your therapists have given you throughout your child's therapy, right? So go home and practice, in our house, it was all these little pieces that start with S, all these words that start with S and put them in a silly sentence, and you have to say that. So we're working on articulation. So things like that, continue doing that. Consider utilizing a second adult or an older child to help. One of the things that can be really stressful is if you are the primary caregiver and you're trying to do therapy, because your kiddo, if he or she gets frustrated during therapy, then they take it out on you, and then that kind of affects how the rest of the day goes. And so if you have a second adult in the home, or somebody that you're quarantining with, or physically with, ask them to help with some of that. Or if you have an older child that's able to help your younger one, ask them to do that too. And that's a really good tip, actually, completely unrelated to COVID-19. When you think about homework, this is a point where there's can be a lot of contention about homework once school gets back into session. And if you can have somebody else help with that, whether it's a tutor, a high school student, somebody else, it changes the relationship between you and your child. And it kind of, you still get to be the safe person, not the person who's yelling and screaming about doing their homework, right? You can reach out to your child's therapist and ask for specific recommendations. Again, if your therapist is through a facility, you might be able to reach them through the portal. And then you can look online for other activity ideas. So maybe, and I put outside, like getting outside, doing something outside, a change of scenery, like we talked about, be creative with your workspace, be creative with your kids too. I mean, oftentimes they can go, sit on the grass or sit on a blanket on the grass and still work on stacking their blocks or putting their cups together, whatever skill they're working on. So I have some resources to share with y'all. First, a few take-home messages. Okay, parenting is hard. Pandemics are hard. Parenting during a pandemic is exponentially hard. You're doing a great job, even if it doesn't feel that way. Set realistic expectations at the start of the day. And honestly, if that expectation is my child is going to eat at least twice today, we're not saying which child's eating, but they're going to eat breakfast and lunch, and they eat cake for breakfast and ice cream for lunch. At the end of the day, they did, you met your goal. You met your goal for the day. So give yourself some grace, come up with those realistic expectations. Ask for help if you need it. We've kind of talked about this. There are crisis lines on the next slide, but call friends, ask family. And even if that's like, hey, can you distract my kiddo on FaceTime while I go cry for a couple minutes? Like, those things happen. Consider changes to anxiety and or depression medications. If you're already on these medications or have a history of using these medications, this could be a good time to get back in touch with your physician and say, hey, I'm super stressed. What do you think? Could we change, could we go up on this medicine a little bit? Or if you've previously been on meds and are not on meds, but feel like, hey, I feel like I need to go back. Or if you've never been on meds and you're also saying, I've never felt this way and I can't shake these feelings and I need help, call your primary care physician. Or your OBGYN, depending on how long it's been since you delivered a baby, because OBGYNs actually write more prescriptions for antidepressants than any other group, which kind of makes sense. But don't be afraid to ask for help. If your brain needs those extra chemicals, it needs those extra chemicals. I'm in a phenomenal mom group here in North Texas. And last week, somebody said, okay, y'all, let's do quarantine confessions because I feel like I am failing. And so these are just a few of, there were over 1,000 comments by the end of the day, but so just a few. So one mom said, as it turns out, not enough time was not the reason why I never worked out. Another mom said, I take conference calls in my car to give myself a timeout from the noise. One said, I'm a lawyer and I had a meeting over Zoom this morning, so I curled the front of my hair, but not the back because no one sees it. I didn't put on makeup because Zoom has a softening filter actually that you can use. I wore a nice shirt with pajama bottoms and slippers. Just keeping it real over here. And the fourth one was, I put Alexa in my 3-year-old's room and the kids yelled at it and danced for an hour yesterday. It was the best idea I've had so far. So we are all struggling. We are all making it work as best we can. We all feel like we failed at some point, probably every day. But again, remember, don't be so hard on yourself. If your best friend was feeling the way you're feeling, what would you say to him or her? And say that to yourself. Be kind to yourself. Remember, we are in this together. And then here is that resources page. So a couple of places, so the Teachers Pay Teachers and the ELSA support, those are great places to go for activities. ELSA support is through the UK, and so to be completely honest, I'm not sure if you want to purchase one of their strategies. I'm not quite sure how that works. I haven't tried it, but they do have some free downloads you can use. Help for Parents and Hope for Children. This is a really great website. Has a lot of great information. This breathing skills practice for children works for adults too. This was actually, this is one of my colleagues at Cook Children's, and it's, believe me, nothing earth-shattering. It is just breathing skills for kids. And I can tell you, when my 9-year-old was worried, of course, the things that mom says, those don't work, right? And so I said, hey, a friend of mine made this video, why don't you watch it? And my 9-year-old, it's like 6 or 7 minutes, has utilized all of the techniques. There's like a fun one where you smell hot chocolate. So you're breathing in and then you're blowing it to cool it because it's too hot. So you're breathing out. The other one I really like is smell the birthday cake and blow out the candles. Again, that same thing, slow breath in and slow breath out. If you are needing help, these are some phone numbers that you can call. There is this parenting helpline. These are all available 24 hours a day, 7 days a week. If you're not comfortable talking to somebody, you can use text. So text hello to 741-741 or talk with us to 66746. So those are just a few options of where to go. Again, there are more resources on the Spina Bifida Association's page. And hopefully between all of these places, you're able to find whatever information it is that you're looking for. This will be posted on the Spina Bifida Association's website. And again, more resources, and thanks so much. Take care. Have a great day.